one.
All right, hand hygiene. Good afternoon, Miss Neal. My name's Harper. I'm going to be performing your examination today. You look like a healthy adult. How do you feel?
Good.
Okay. Can I get you to tilt your head down? Have you noticed any changes in your hair?
No.
Anything wrong with your scalp?
No.
I'm not seeing any lesions, baldness, or flaking. As I palpate, I'm not feeling any masses or tenderness. Come back up for me. Your temporal arteries are palpable. Open your mouth and close. Any tenderness here at this joint? Okay, great. Your face seems symmetrical. I'm not seeing any lesions. Same with your eyebrows, eyelids, and eyelashes all look symmetrical to me. Your lacrimal ducts are not edematous. Your eyes are not excessively teary or dry. Look out for me. Conjunctiva is pink and moist, and your sclera is white. I don't see any abnormalities in your eyes. Can I get you to tell me when and where you see my fingers moving? Okay, they're going to be in different places. So when and where? Ready?
Top right.
Okay.
Top left. Bottom left. Bottom right.
Okay, great. Now I want you to follow my finger without moving your head. I'm assessing your extraocular movements, okay? I'm not seeing any nystagmus or lid lag. That's great. Now I'm going to look at your pupils. Okay, just kind of look straight at me, all right? Your pupils have direct and consensual reactions. They're about 3 to 4 millimeters. I don't see any abnormalities in your pupil size or constriction. Can you look at a spot behind me on the wall? And now look at my finger. Good. Your pupils accommodate appropriately. So now we're going to move on to the ophthalmoscope. All right. Pick a spot on the wall behind me. I can see a red reflex. I see an optic disc, your macula, and your fovea. All right. Same thing on this side. Pick a spot behind me. I can see a red reflex, optic disc, macula, and fovea. This is great. All right, I'm going to move on to your ears. Can I have you turn your head? I'm not seeing any redness or discharge from your ears. Any tenderness when I press on your tragus? How about when I press on the maxillary bone? No tenderness? Okay. I'd like to take a look inside your ears, if that's all right, before we do the hearing test. Okay, I'm going to pull your ear up and backwards. My scope. Your auditory canal looks clear. There's some cerumen, but no more than what's normal. Your tympanic membrane appears to be pearly gray. Cone of light is at 5 o'clock. I can see your pars tensa, pars flaccida, and your malleus. This is good. Okay, now can I get you to turn your head? Okay, auditory canal on this side is also clear. No excessive cerumen. Tympanic membrane is at 7 o'clock. Malleus, pars tensa, and pars flaccida are intact and visible. Great. Have you had any problems with your hearing?
Yes, I don't hear very well, but I'm not sure which ear.
Okay, so what I'm going to do is stand behind you. I want you to just repeat what I say.
Okay. 7.
Can you actually, I'm sorry, can you occlude this ear
sure.
for me, and then if you don't mind, just facing forward.
8, 7, 18, 32, 4, X.
Okay. And then occlude this side.
R, S, 7, 13, 18, G.
Okay. A little bit of hearing loss. I would refer you to a specialist probably for that. So now I'm going to use this tuning fork. I want you to tell me if you can hear it equally on both sides.
Okay. Yeah.
Okay. Now I want you to tell me, I'm going to do each ear, tell me when you can hear it and when it stops.
Okay. Yes. Now. Yes. Now.
Okay. Can you turn your head?
Yes. Now. Yes. Now.
Okay. Your air conduction is longer than bone conduction, which is normal. So now I'm going to actually look at your nose. Can you tilt your head backwards for me? Your nasal mucosa is a reddish pink. And I don't see any polyps on your turbinates. And your septum is intact without deviation. That's great. Your nares are symmetrical. No problems with your nose. Now, are your sinuses, your maxillary sinuses, are those tender?
No.
What about frontal sinuses?
No.
Okay. So now your posterior cervical lymph nodes. Okay. Your occipital lymph nodes. Post-auricular lymph nodes. Preauricular lymph nodes. Tonsillar lymph nodes. Submandibular lymph nodes. Segmental lymph nodes. Your cervical chain, superficial cervical chain, and deep cervical chain. And we have your superior clavicle. I'm not feeling any tenderness or swelling in your lymph nodes. That's good. So now I'm going to feel your trachea. Look straight. Your trachea is midline. Can you swallow? Okay. Your thyroid rises when you swallow, and I'm not feeling any nodules or masses in your neck. Okay. So now, last thing. Open your mouth for me. Okay, stick your tongue out and say ah.
Ah.
Your oropharynx is pink and moist. Your uvula rises in this midline. You don't have tonsils, do you?
No.
Okay. Can you stick your tongue straight out at me and then move side, side? I didn't see any ulcerations or patches in your mouth. Can you turn to the left? Or just your neck, I'm sorry. Go straight, just turn your neck to the left. Good, and to the right. Okay, can you side, side? You have difficulty with that?
A little bit.
Okay, can you come down? Okay, and then all the way back. Range of motion is okay. A little bit of stiffness, I think, on your left side, but otherwise you appear normal.
Great.
Thank you.